Language delay is one of the most common developmental delays in young children that occurs when children do not meet developmental milestones for language acquisition. Children may have a receptive language delay, meaning that they have difficulty understanding language, or an expressive language delay, meaning that they have difficulty speaking or producing language, or they may have a mix of both. Babies usually start babbling at about 4 to 6 months old and go on to develop their first words at around 1 year old. At this point, they should be able to also respond to their name and to simple instructions like no or come here. After 1 year, children should continue to regularly acquire new words. And by 2 years old, a child should have 50 to 100 words, which they can then begin to combine to make 2 to 3 word phrases. At this point, they should be able to follow simple instructions like throw the ball. And they should also be able to point to body parts and pictures in books. By 3 years old, a child should have a word for most things, and they may begin to talk about things that have happened in the past or might happen in the near future. They may also begin to ask questions like why, when, or how, and most people should be able to understand your child when they speak. For a full list of developmental norms, please visit the link provided. If you do have concerns about your child's language development, it's essential that you contact a speech and language therapist as soon as possible, as early intervention really does lead to best outcomes. Language delays often run in families, so there seems to be a genetic link, and boys are more likely to have a language delay than girls. They may be part of another diagnosis like autism or Down syndrome, and they can also be due to hearing impairment, ear infections, or intellectual disability. Environment also plays a big role in language development, with children from poorer or less educated families being more at risk of having delayed language. Two of the most common things that I see when I work with children with language delays are quieter children who may be babbling or vocalizing less and not using vocal play, and children that may have difficulty learning and keeping new words. One of the tools that I use to target both of these things is the Forbrain. Forbrain is a wireless altered auditory feedback device that has a microphone, a speech filter, and uses bone conduction to stimulate the auditory nerve directly, so that when we wear it, we can hear ourselves in real time, but just slightly louder. Forbrain is not designed to replace therapy. It's made to be used as a complementary tool alongside other evidence-based practice methods. When we hear ourselves slightly louder, it makes it easier for the brain to process the speech signal because it's a little bit more salient, which makes it then easier to retain the things that have been said and heard. When I first introduced the Forbrain to a child with language delay, I like to make it really fun and take turns. First, I'll say, "Ooh, my turn," and I'll place it on my head, and I'll look at myself in the mirror, and I'll make really encouraging noises like, "Wow," or "Cool." Then I'll take it off my head, and I'll say, "Your turn," and I'll help the child place it on their head. I like to make sure to always have a mirror present because children really think that they look cool when they wear the Forbrain, and they're motivated to see themselves wear it. I'll keep the volume turned down really low to begin with, just while the child gets used to the sensation of having something on their head, and then as they get more comfortable with wearing the Forbrain, we can gradually increase the volume. Once the child is comfortable wearing the Forbrain, I aim to keep it on for about 10 minutes per session, or for as long as the child is comfortable keeping it on for. Because it's a wireless headset, it's really great for using during play-based therapy. So things like playing with dolls or cars or trains or food, really anything that the child likes to do. If I'm doing focused language stimulation, I can have the child wear the Forbrain and turn the microphone towards me. But for every other type of activity, we're going to be having the child wear the Forbrain with the microphone about 3 centimeters away from their mouth. Forbrain can be a great tool to use at home for carryover in between speech and language therapy sessions. Just as I would during my sessions, you could aim to use it for about 10 minutes per day during fun, play-based activities where you're using the target words or vocalizations given to you by your child's therapist. In using Forbrain in my practice, I've seen that some children seem to discover their voice and start vocalizing more, which has led to increased babbling, vocalizations, and vocal play. I've also seen that some children seem to acquire and retain new words quicker, and that they're more motivated to participate in therapy because they enjoy wearing the Forbrain. They like how it looks and they feel really cool and special when they get to wear it. Some of the families that I work with have also really enjoyed having something concrete to have at home to use in between sessions to continue to boost language development.